Hello, my name is Lucy Ambrose and I am the MBBS Programme Director here at Hull York Medical School. And over the next few minutes, I'm going to talk to you about our programme and explain why we are a different kind of medical school and hoped to inspire you. Hull York is a unique partnership which has been designed to make a difference. We have combined strengths between the two universities of Hull and York in scientific research and patient-centred care to ensure that our students graduate with the skills needed to thrive in a rapidly changing healthcare world. We operate from both university campuses and within hospitals, primary care and other community settings in North Lincolnshire, the Humber, Tees Valley, Northern Lincolnshire and Goole. And these are all shown on the map on this slide. Our vision is to offer a nationally leading and internationally known medical education that produces excellent doctors equipped with the knowledge and skills to respond to challenges within healthcare and to transform patient care. We have two routes into medicine at Hull York. We have the Gateway programme, which is medicine with the Gateway year, and we have the medicine programme. Now, the Gateway programme is widening access to medicine with a standard offer of BBC, with a B in biology and chemistry. And there is automatic progression to the 5-year programme on successful completion of the Gateway year. The 5-year programme is a dynamic 3-phase programme with a standard offer of AAA, including biology and chemistry. The Gateway year is about widening access to medicine, and its purpose is to facilitate transition from school or college to university. We are committed to raising aspirations and supporting and encouraging those who wish to pursue a career in medicine but do not have the standard entry requirements for our 5-year medicine programme. The Gateway year is a year that forms the first year of a 6-year programme and is the first academic year. It facilitates a transition and offers clinical placements in primary and secondary care from the start of the programme. It combines hands-on clinical experience with small group teaching, lectures, clinical skills sessions and self-directed learning to ensure you succeed. Upon successful completion of the year, you gain straight access into the 5-year programme. The 5-year programme has 3 phases, and the first phase is the foundations of medicine. In years 1 and 2, the focus is on being based in either Hull or York with placements within 30 minutes of your home university. Teaching occurs within both the university and clinical settings. And there is also an opportunity to tailor your experience through our scholarship and special interest programmes, where you're able to explore an area of biomedical science alongside areas of medicine. Our early years programme in phase 1 is also focused around problem-based learning. And this approach to learning develops depth of understanding and knowledge. And it's about guided discovery with structured learning outcomes. And I would really recommend that you watch the presentation by Mary, which explains how problem-based learning works and how we use it at Hull York Medical School. There is small group learning, which develops communication and team working skills, which are needed within the NHS workplace. And there's also self-directed learning, which helps you to develop research, problem solving and analytical skills. All of these are key to clinical practice. And alongside this, you develop your clinical and communication skills. And these are taught by practicing NHS doctors and educators. And there is a focus on communication as well as physical examination and clinical reasoning, which is the process by which doctors make diagnoses and they make decisions about management. And clinical reasoning is really integral, will be integral for your whole careers in medicine. And we prioritise it very early at Hull York Medical School in order to really develop that skill as you progress. These are reinforced the skills that you learn during time in primary and secondary care settings from week 3 of your programme. And that's what's really key about your experience as a student at Hull York Medical School, is the early and sustained clinical exposure. You have regular placements from week 3 of your programme. There's a breadth of experience within primary and secondary care settings, and there's a range of settings from rural and coastal regions to densely populated urban environments, alongside a variety of patient demographics and experiences. Anatomy is really important in medicine, and we have a specific area that we talk about here so you understand how we enable you to learn about anatomy at Hull York. We have weekly anatomy lectures from week 1, year 1. There are smaller group laboratory sessions, and there's a combined approach using prosections, anatomical models, radiological imaging, and clinical examination of living anatomy. And our graduates graduate with a solid foundation from which to pursue any specialism, including surgery. Phase 2 of the programme is full-time clinical placement, and this is years 3 and 4. And this is where our geography comes into play, because you will be placed in locations across our region and full-time in primary and secondary care placements, and that's clinical placements. You will have experience in different specialities and locations, and there are dedicated teaching facilities and student liaison teams within each hospital site. And then there's the opportunity to intercalate. And intercalation is where you take a year away from the programme, where you study for an additional degree. That can be in Hull or York or further afield. And there's lots of opportunities within the universities of Hull and York to do a further degree. And phase 3 is the final part of the programme, and that's being part of the NHS team. So in year 5, you're a member of the multidisciplinary medical team. You experience on-call and out of hours, and you also have the opportunity to do an elective, which is a chance where you organise it yourself to go either in the UK or abroad, obviously depending on circumstances at the time, to look at an area of particular interest or to try and experience medicine in a different setting. And also in year 5, we have the assistantship. And this is a chance where you work alongside a junior doctor for a number of weeks and really put all of that knowledge, skills, and professional behaviours that you've learned during the course, and you put them into work. You put them to work alongside a junior doctor to really prepare you for the first few weeks of your foundation programme as a junior doctor. The next thing that I want to talk to you about is our facilities, and they are amazing. So the University of Hull was founded in 1927 and has 20,000 students, and a lot of money has been invested in the campus, over 200 million, with 28 million alone going into the health campus. And the medical school is fortunate to have this award-winning medical building. Now, that was voted in 2018 by the Guardian's University Awards as a building that inspires, and it really does. And it is wonderful to be able to have our students learn in such an environment. The University of York equally has brilliant facilities, and it was founded in 1963 and is a member of the Russell Group. It has 16,500 students overall across the whole university. And since 2000, they've invested over 500 million in facilities, including 5.8 million in the medical school facility. The building at York has just been refurbished, and it opens this year with problem-based learning suite and a collaborative learning area for students on the first floor, and lots of access to the programme delivery team, student support, as well as to people like me who are the leadership of the programme and our dedicated healthcare professionals unit. And there's opportunity to do your clinical skills in a space that is shared with other healthcare professionals, and that opens up opportunities for interprofessional learning as you progress. The picture on this slide shows the newly refurbished area in the University of York building, and it is brilliant. So we also want to support you to succeed, and your tutors will be very integral in this, your PBL tutor, your clinical skills tutor, and your phase lead. And we also have the medical school student support delivery team and programme delivery team who will help you. We believe in equality, diversity and inclusion and welcome students from a diverse range of backgrounds. We recognise that each medical student may need different levels of support to thrive and progress in our programme. And our in-house student support teams are available across our host universities and out in all hospital placement sites and are highly valued by our students, as I've just explained. So really important we want you to thrive, we want you to succeed, and we want you to excel at Hull York Medical School. This is a quote from a previous programme director, and I've kept it in here because I think it really sums us up. You will graduate from Hull York Medical School with in-depth knowledge and a sensitive understanding of people, as well as the ability to communicate effectively and work as part of a team. We will train you to deliver the exceptional care that will transform the lives of your patients. So this sums up Hull York. Confident, compassionate, exceptional doctors are made here. And I hope that you enjoy looking at all of our admissions information, and that if you have any questions, you're able to contact us. Thank you.